Welcome to the Allied Health Professionals podcast series
with your hosts, Jennifer Trafford
and Alison Kerr.
Happy New Year.
And welcome to 2025.
So today's guest for our podcast for the new year is Carol Martin. Welcome to the podcast, Carol.
Hello, good morning.
So it's really good to have Carol here. So Carol came into this post in 2024, so you've been here for a little while now. What are your reflections about this new role within the Allied Health Professional structure?
Yeah, thanks Alison and Jen. Great to be here and thank you for having me. It's been a fun year, learned lots of new things, been exposed to lots of new things. My new role is professional lead for allied health professions, and I see it's a real privilege to be able to recognise and promote all the different contributions that AHPs bring to a patient's journey and the value that they add, and being able to promote that across the organisation to really develop the opportunities further and the skills as well and the workforce across the AHPs. So it's a real privilege being in this new role, and I don't take that lightly at all.
So what's your background?
My background is I'm an occupational therapist by profession. I've worked across the acute trust, I've been out in community quite a lot and worked in social care as well. I've been in a general manager role and also worked across the different organisations across health and social care around hospital discharge in a sort of system role as well, and then come into this new role across the allied health professions, which has been great.
So loads of kind of like knowledge to bring. Have you always been at South Tees then? Or?
I've always been employed by South Tees, but as occupational therapy is an integrated service across health and social care, which is quite unique nationally and something that we need to be shouting about it at South Tees. So I've always been employed by South Tees, but worked in Middlesbrough Council for quite a number of years in a variety of different roles there.
I was really surprised actually when so obviously my previous job looking after the allied health professional students, the first time I got told I had to go and meet some students and they were in the Middlesbrough Council, and it really shocked me that.
Yeah.
So you're totally right, we don't talk about this stuff, do we?
No.
That how much our reach kind of goes into our community areas especially.
Yeah, and it's a real benefit because it breaks down barriers, it reduces delays for patients and gives that continuity of care across pathways and gives that opportunity that a lot of places and areas don't have, and access to equipment and other shared budgets and shared management and shared learning opportunities, which is brilliant and something that is unique in this area.
Yeah, I think Carol coming into this role from an AHP workforce point of view has been really important, and it's been really great to see just the knowledge and the skills that you've brought into the organisation, and I think it's really helped develop the AHP structure and to support me in my role as looking at the workforce, because it's just those new skills and thinking outside the box in different areas. You know, I'm from an acute trust, I've always worked here. It's really nice to get that difference of opinion, different of personality types, the way we do things. So I think it's really strengthened the AHP community.
Great. Thank you. And I think the good thing on the back of that, Ali, as well is, you know, as we look to the future, and we've talked a lot about the clinical boards and the future developments across the group, you know, there's a lot of focus around community. And I think the more, as allied health professions, we play a huge role in community and supporting our patients out there to be as independent as possible and in so many other ways as well.
So 2024, obviously big year for you, lots of change, but I think there's been lots of change in the allied health professional community in general, hasn't there? And we've got some real highlights to celebrate for 2024. I think we should be shouting about them, don't you?
Yeah, I think that's one thing that we need to go into 2025 doing, is really shouting about our successes. I think 2024 really showed us some really good examples of how AHPs can work in different roles. My role got made permanent, which was fantastic. Obviously, Jen, you've had a lot of changes going in your world.
Yeah, I obviously left the allied health professional PPF role and stepped into the human factors and civility role. Do you know what? I'm loving it. And I'm loving the fact that I still get to dip into my allied health professional kind of hat as well, because that was my big worry, was when I left the role that I would lose that allied health professional contact. And for me, it's part of my identity now. It really is. I think it's really important that we all keep that.
Yeah, and I think we've had this discussion with Carol, because obviously we've all moved out of our comfort zones, if you like. So then we're working in these quite isolating roles at times. I think that's something that we've recognised and been able to pull together to say, look, you're not on your own, you're creating your teams, it's just a new team of people. And being able to do things like this really gets you to link back to your community, your roots, and being able to like know that you're not on your own if you're in these roles. There is always people there for you, just sometimes need to seek them out.
Yeah, I think just a couple of things to add there is it is fantastic having Ali permanent in her role now, and the difference that's made has been so key. You can see the development in the AHP community over the last couple of years. Having Ali in post has really been quite instrumental to a lot of that, and we're building on that now. And you know the advances and the difference that there's been has been amazing. We're still on a journey and there's more to do. There's always more to do, but we can certainly see that improvement. And I think as well, allied health professions are often unknown in some of the smaller professions particularly. So Ali's been really key, and Jen as well, in relation to doing podcasts and webinars around career development and also careers awareness. So of being aware of those smaller professions. And we've seen an increase in the number of people applying to do some of those roles as well, and applications coming into the trust, which is amazing and brilliant, seeing the output from the work that's been done.
It is. It's great because you think about 2024. We got our board, thanks to you. You forget that, don't you?
I do, yes. We moved on from that, but now hopefully we'll be joined with a nursing board and a healthcare scientist board as well.
And that board is situated outside pharmacy on the main corridor. Please do go and take a look if you haven't seen it.
And then we've got one in the Friarage as well, don't we?
Yeah.
Kind of highlights that. And that, like you say, along with the webinars and the podcasts, we're just elevating it, aren't we? We're making people aware of the other choices and the career paths that are out there.
And those roles supporting our allied health professional staff, which actually amounts to 1,500 staff across South Tees.
Wow.
And as we think across, joining across the group, that is massively, it's going to grow. It's going to be a much bigger group. So those roles are really instrumental in the future development of our staff and workforce, and making sure we have the workforce to support our patients in the long run.
Absolutely.
And some of that impact I've seen on our Allied Health Professional Day when we did a few different activities, and we had Leah Brett, and she's actually offered to do coaching for some of our Allied Health professionals. So if you've ever got any questions or anything about coaching or mentorship, come and speak to us, come and speak to your team leads, because there is people in this organisation that are fantastic at what they do and can help coach through situations, interview prep. Anything like that can be highlighted to us, and we can really try to drive it forward. The civility stuff that Jen does and the human factors, it all links in to keep raising that profile and to make each individual practitioner the best they can be.
Yeah. And I think on the back of that, Ali, that in this new year, and as we move forward in this year, I'd like to challenge all our AHPs to step outside of their comfort zone in one way. Find something that you find a bit uncomfortable, but is absolutely right to do for the sake of your patients and for moving forward. And that might be accessing coaching or mentoring. That might be stepping into a new role that is outside of your profession, because you have the skills and the ability to do that. So, think about that. Think about what that is for you and take that step.
Yeah, it's a good bit of advice there, actually, because that's the thing, is just stretching yourself outside your comfort zone can really open doors for you. And then we get allied health professionals into other areas, which again elevates the professions, and it just highlights everything that we've them transferable skills that we all have.
Yeah, and you will add value to the organisation in doing that as well, and to your patients' journeys in multiple ways. So please do that, and also if you're a bit scared about that, and that's something you're thinking, oh man, that's a bit too much, come and talk to us. Our door's open. Come and speak to us. Always happy to support. We've been there. We've done it. It isn't always easy, but go for it.
Yeah,
that's kind of what you did, though, isn't it? This year, you've done exactly what you've practiced what you've preached.
Yeah.
So what's your first year been like then, in that stretched kind of capacity?
Yeah, I guess coming into this role as professional lead for allied health professions, it's recognising where your blind spots are, and I absolutely had to do that. From as an occupational therapist, there's some areas that I don't know so well. and there's two representatives of those professions in the room. Therapeutic radiography wasn't something I was very knowledgeable around, or operating departmental practitioners. As an occupational therapist, you don't come across them particularly in your career. So it's very much recognising the areas that are your learning areas, and they're the ones that I've probably, it's going and spending time shadowing, learning, asking questions, being curious. And I've learned a massive amount, and it's been a privilege to sit with practitioners in various places, in clinics, actually just watching what they do day in, day out. And the passion and the dedication I've observed has been phenomenal and a real privilege. So I've learned loads. They've spent time, taking the time to do that, and sat in meetings and places and talked about what I've seen and how difference that people are making and raising the profile for AHPs, which is part of the role. So it's been great. And I think seeing some of the examples of, one of our dietitians who works with one of our partner agencies in really promoting good nutritious menus for our patients, really aiding and helping their recovery and wellness. What an opportunity and a skill set there. And our palliative care therapy team producing an amazing and really powerful patient experience video about bringing hope to a gentleman who wasn't palliative aspect of his care, but bringing hope at that time to him and his wife, and him sitting talking about that experience was really powerful and amazing to see. So they're just two examples. I could go on and tell you more and more. So yeah.
The thing is, I think when we look at it from the other side of things, from the fact that you went out there and you shadowed people, from a leadership side of things, actually, we really appreciate it. We especially the smaller groups, the lesser known groups, we really appreciate somebody coming in and asking questions and being curious about us, and it makes us feel heard. And I think that's been another turning point this year is this, like you and Ruth and you and Alison kind of getting out there and getting people talking and then sharing that learning with other professions where people have sat up and gone, oh, we could share with that, we could learn from that, we could dip into that and actually help and seeing where we could all connect and where the connections are. And from the other side of things, that's what leadership is, isn't it? It's putting yourself out there and letting people know, I'm here, we hear you, and we know what you do. It's really important.
You've got to really, really manage your time, well, haven't you, Carol, since you've come into this post?
Absolutely. And I'm aware that I haven't got around everybody. You get so far and you can be afforded that time initially, but then the work starts ramping up. But if you want me to come and see, I'm more than happy to. So get in touch if there's any, if you think we'd like you to come and visit and come here, then absolutely I will prioritise that, because I'm aware I haven't got around everybody. I still don't know it all. We never do. I think if we do say we know it all, is that correct?
Red flag.
Because there's always more we can learn and improve on. So still happy to learn and get out there again as well. So if there's an offer there.
Brilliant.
I think one of the key skills is that I've seen, particularly with Carol coming into post and with the senior leadership team in the allied health professional, is that open-mindedness and listen. And I think that's been really key to getting engagement and getting people on board, is that, you know one profession really well, but to advocate for all the other professions, you have to listen, and then you have to think about that in every environment you go in. And I just want the AHPs to know that every room that we go in, whether it be Jen, Carol, Ruth, we are always thinking, could an ODP do that? Could a paramedic do that? Could a podiatrist do that? Is that just something that radiographers are doing, or could physios be doing it? It is always thinking like that, and we will always happily to be challenged on that we're thinking like that, because that is our job as AHPs.
Yeah, absolutely. And of course, there's not just you came into post. We've had other changes, haven't we? We've got a new allied health professional lead across the group as well now, don't we?
Yeah. So Alan McDonald coming to post over the group, so over University Hospital Tees.
I have to think about it every time, honestly.
I'm getting there, but yeah. So he's coming in. So obviously the next few months we'll be seeing Alan around different areas, picking up on the different things. Obviously North Tees and South Tees are going to be working together, and I think there's a lot of exciting opportunities coming up over 2025 for how we work together and how we share best practice, which is really exciting for AHPs, because we're always up for working flexibly and being adaptive and problem solving. That's our go-to.
I think we still have to acknowledge a level of being unsure and nervousness about this new kind of step into this group model, don't we? And that's fair. And do you know what?
It's natural.
Yeah, natural. Change is difficult and sometimes, like we said earlier on, stretching yourself. But again, it's asking that question of let's be open-minded and stretch ourselves. So do we know what's going on in 2025 with the group model?
So at the moment, I guess just going back to last year initially, is that prior to Alan being in post, he was over at North Tees. So he's got an awareness of North Tees, which is good. We were already, Ruth and myself and Alan were meeting on a regular basis, looking at how we can share things across the different trusts as well at that point. So actually, Alan coming into post is a positive, and looking at how we move forward from there and what the structure around allied health professions will be like. It is an unknown at this point in time, but I'm sure there'll be times where we'll be asking questions of yourselves, because it's absolutely key that people have a voice, and we'll be keen to listen and to hear from yourselves at different times throughout the year, depending on what's happening. So it's a bit of an unknown at the moment, but there will probably be some changes throughout this year. But what I'd ask is for you to approach it in a positive way. Remember the great stuff and think of the things that you don't want to lose, things that are really important to ensure great patient care and outcomes. Keep them at the forefront of any change that's happening, because we want to capture that and make sure that moves forward. And depending on where you work, try and make links with your counterparts over in North Tees and have that shared knowledge base. I know a lot of areas do that already. They already have that, and just build on that and keep working together, because the more we can learn from people outside of your own area and also regionally and nationally is a real value, because that all helps us develop our skills and provide better care, evidence-based care for our patients. Yeah. And that's what we're here for. That's what we're here for, and that's what we're about. And I think just on that evidence base, I think one highlight for me this year or last year was spending time with the research team in radiotherapy. Wow, what an amazing bit of work that they do there, and the difference that's made to the treatment regimes that they're now utilising, and the number of treatments that have reduced because of that research that's been taken, and they're higher than anywhere else in the country in the recruitment for those patients for the trials as well. I was blown away. So well done to them.
You said it earlier on, before we started the podcast, actually. You said the thing is you've spoken to people in North Tees and you've spoken to people in South Tees, and you know that there's some really excellent work going on in both areas. Yeah. So actually, us joining together and learning from each other and learning best practice from each other can only be beneficial for our patients. Yeah. So it's quite an exciting, yes, it's nervous time, but I'm quite excited about it. I'm quite excited where this might go.
Yeah, I think it can be. We just need to keep the patients at the centre and hold on to those things that are really important.
So some of the highlights going back on 2024, we have, as AHP teams, have won some national and regional awards, which I just want to highlight that our teams have been working so hard, but also looking at getting yourself out there, nominating people for different awards, look what's out there, and because it's absolutely fantastic. I think the highlight for me from 2024 has been Allied Health Professional Day, which I know this is going to be a difficult task, but I feel like every year we need to make it bigger and better. 2025, my wish would be that we look at a more digital avenue for promoting AHPs, and I'd be happy to have any advice from anybody about how we get into those digital spaces and make sure we, cross the generations of how we promote ourselves.
Ooh, my highlight of 2024. I would say my highlight is the new job that I've stepped into as the Human Factors and Civility Educator, and the fact that I've been able to bring the learning that I've had from the allied health professional world into that, and that I've still been able to keep my connections with the allied health professional world while developing this new role. And for 2025, I'd like to continue that on. I really would, because I think we've talked about it throughout this podcast, actually. We're really good at culture when it comes to allied health professionals, because we are out-the-box thinkers. And I think I would like to keep kind of bringing that element to my new job.
Excellent. What about you, Carol? What's your highlights of
I think
2025?
my highlights are, well, yeah, there is a couple of highlights. One is spending time with different professionals in clinics and in different places with seeing patients, the treatment with patients, and just seeing the dedication and passion, as I mentioned earlier. That was one highlight, definitely, and learning through that. And the other highlight was AHP Day and the awards in the afternoon. And there was tears, there was laughing, there was hilarity, there was kind of a soberness in some of the stories that were told, and just such a range, lots of fun, but lots of real poignant moments where just the realization of the difference that had been made. It was really powerful and great to see and be able to witness that. And that was my highlights. I think moving into 2025, my want and aim is to, as we move towards the group structure and as allied health professions, just make sure we capture all the great stuff, making sure that we, as we move closer together and work together, that we get it right. By right, I mean making sure that patients are absolutely at the centre of any changes that are made, but that we support staff in that whole process effectively to make sure we get that right and that we get positive outcomes throughout this year. That'd be great.
Yeah, I'm looking forward to it. I think we'll have some great podcasts ahead in 2025. We've got some already lined up. In fact, we're getting quite a lot of requests, which is amazing. We've got some people from your team coming in to do fantastic podcasts.
We've invited Jenny Winard and Andy Heaney to come in to talk about culture and organisational development and the importance of that when it comes to our patient safety. And we're going to talk a bit about human factors and civility during that podcast as well. So we're looking forward to that one from my point of view.
Yeah, I think we've got the Falls team lined up and some great work that's going on in Hambledon Rich community in the therapies. And I think we've got our consultant AHPs coming to do a podcast. So stay tuned. 2025 is going to be all about AHPs.
I hope you all had a lovely Christmas and a wonderful New Year. And we look forward to catching up with you all at the next podcast. Look after yourselves
And each other.
Thank you.